Arteriosclerosis is a general term for narrowing and hardening of blood vessels, with atherosclerosis being one of the types. However, commonly they're used interchangeably when having discussions about risk. So atherosclerosis is a progression over many years. You can have two things happen. First, you can have symptoms related to the narrowing caused by decreased blood flow to the organs in the body. And the second thing that can happen as atherosclerosis progresses is you can have a rupturing of the plaque in the blood vessel, causing blockage of the vessel and sometimes a stroke or a heart attack. So atherosclerosis we think of as a narrowing of the blood vessels, and we have to think about which organs those blood vessels are going to. So we can see heart attacks or chest pain when it's the arteries to the heart. We can see neurological symptoms such as difficulty moving or difficulty speaking when it's the arteries to the brain. Or we can see pain with walking or acute leg pain when it's the arteries that are supplying the blood to the legs. The location and the organ that's impacted by the atherosclerosis is all related to the blood flow from the heart to that particular organ. Atherosclerosis can be treated in several ways. One way is by modifying the risk. So cholesterol medications are very important. Blood pressure medications for good control is very important. And other medications like antiplatelet agents such as aspirin are commonly used. But before we get to medications, it's important that patients are looking at lifestyle modification to improve their risk. Lifestyle modification that helps with atherosclerosis includes weight loss, decreased sedentary lifestyle, partaking in a structured exercise program. Diet is very important when it comes to atherosclerosis because of its impact both on blood pressure and cholesterol. So low-fat diets, low-salt diets, increasing your vegetable intake, your oils, those are important factors in your diet that will have a benefit on your long-term risk from atherosclerosis. So we encourage all of our patients to make sure to make changes as soon as possible and to keep them over long term to decrease their risk.